Hi, I'm Dr. Avni Engley with Northwest ENT and Allergy Associates, here to talk to you about your child's ear tube surgery. So the reasons for ear tube surgery include recurrent infections and persistent fluid lasting between 3 and 6 months. Oftentimes children have fussiness, irritability, pulling at ears, and high fevers associated with these infections. Once the infections become recurrent and your child is requiring lots of courses of antibiotics, your primary care doctor or your ENT may have recommended ear tubes. So the purpose of ear tubes is to equalize the pressure between the outside world and the space behind the eardrum. Ear tubes may decrease the frequency of ear infections, or they also provide the advantage of allowing us to give ear drops to your child instead of giving systemic antibiotics. Ear tubes are placed in the eardrum with a brief period of general anesthesia with a mask. The procedure itself typically takes 5 minutes or so in the operating room. A tiny incision is made in the eardrum and the ear tube is inserted. Fluid is also suctioned from the ear. Risks of this surgery include perforation in the eardrum, a hole that doesn't heal. This happens in less than 5% of patients. Also, tubes are intended to stay in the eardrum for between 6 and 18 months. Occasionally, the ear tubes may come out too early, and sometimes they stay in too long and must be removed. After surgery, your child will perhaps be a little bit fussy. Pain is most often controlled with Tylenol and Motrin alone, and we will also recommend ear drops be used for 5 days. They are given to the child twice a day for that period. You may notice once the ear tubes are placed, when your child has an ear infection, they will drain mucus or pus from their ear canals. You may notice staining on the pillows or around the opening of their ear canal.
This video is presented for general information purposes only. No attempt is made to include all significant risks and benefits of surgical procedure and may not apply to a particular patient. Review with your physician any questions before signing the informed consent form.